Welcome to the City Current Show, powered by Hagen-Botham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, Andrew Bartolotta.
Welcome back to the City Current Show, where we bring you inspiring stories of individuals and organizations making an impact and powering the good in our community and around the globe. I'm your host, Andrew Bartolotta, and today we have the honor of speaking with Marissa Lima, Senior Development Manager at the American Cancer Society. We'll be discussing the incredible work that they're doing to fight cancer, including the vital services provided by their Hope Lodge, the powerful Men Wear Pink campaign, and even their Making Strides Against Breast Cancer walk. We'll also delve into their groundbreaking new cohort study, Voices, aimed at addressing cancer disparities among African American women. Marissa, thank you so much for joining us.
Thank you for having me. I'm happy to be here.
Of course. Okay, many of us know, but go ahead and give listeners an overview of the American Cancer Society and its mission.
Okay, absolutely. So most people know the American Cancer Society for our research, which is a big part of what we do, of course, but we've been around for 111 years. And our formal mission is to improve the lives of people with cancer and their families through advocacy, research, and patient support to ensure that everyone has an opportunity to prevent, detect, treat, and survive cancer. And we do that in a number of ways. And we really focus on three pillars at the American Cancer Society. Like I said, most people know us for our research, but we also we refer to that as our discovery pillar, but we also have an advocacy pillar and our patient support pillar. So those three pillars are what we are founded on and where our work mostly focuses. So we originally, something I just learned recently, which I think is really interesting, is that we were actually 12 organizations until just a few years back. We were a federated organization with separate CEOs, separate everything. So the ACS out on the West Coast and the ACS on the East Coast were two very different entities. And just in recent years, we have been combined into one legal entity. And so now we are much more streamlined, and it's a different organization than it was many years ago. So I also find it amazing. I've been with the organization for about a year and a half and realized that we only have about 3,000 employees across the nation. So we are very much a volunteer-based organization. We have over 1 million volunteers across the nation who support our efforts. So we are volunteer-led and staff-supported. And that is, that is really saying something for those 1 million+ volunteers that are doing this work for us, because we can't do it without them. Those three pillars, Dr. Knudsen, who came on in 2021, she is our first female CEO. She's also the first scientist to be a CEO for us since 1945. And I think that gives us a little bit different perspective on things. And she is very focused on those three pillars that I mentioned. So we've done a lot of work in the research pillar, of course. We've seen an overall cancer mortality rate reduction of 33% since 1991. We've had 50 researchers go on to win the Nobel Prize, which is, the greatest prize that a scientist can achieve. And in the last 30 years alone, we've invested more than $600 million just in breast cancer research, but $5 billion in research for all types of cancer since 1946. So we fund both intramural and extramural research. So we have our own researchers at ACS who are doing great work, but we also fund places like just right here in Memphis. We fund work at St. Jude and other amazing hospitals around the world. So one of those intramural studies, which we'll talk about later, is the Voices study, which is something that we've launched this year. We're very excited about. But again, we are working with hospital systems all over the nation in that research pillar. And we feel like we're really making a difference in getting new treatment, getting the word out, getting the screenings out. I don't know if you've seen that, screening guidelines have changed. We're always improving those sorts of bits of information. And then, back to the other pillars, the advocacy pillar, we're out there at all levels of government, local, state, federal, working to, move legislation in the direction that is patient friendly, and that gets patients the resources that they need to fight cancer. And then finally, that third pillar, the patient support, that is our direct patient support pillar, where we are out there actually working one-on-one with patients in a number of different ways to support them through their journey in the cancer realm. So, while we're known for research, there is so much more going on out there that we want people to know about. And for instance, right here in Memphis, we have a Hope Lodge on Union Avenue next door to Sun Studios. That is one of our most important patient support pieces of all. And yet, sadly, many people don't even realize it exists here in Memphis. I probably drove by it 5 million times on Union Avenue without even realizing it was there. But it is such an amazing resource for our community and surrounding communities. So one thing that I really want people to know is that there's so much more to the American Cancer Society than just the research that's going on. That's important, but it's just one piece of what we do.
Well said. And like you mentioned, research is vital, but it is just one pillar of what you are doing. You mentioned the Hope Lodge in Memphis. cityCURRENT has taken groups of our CEO, our partners, our nonprofit friends through for some nonprofit tours. In the past, I've been able to, as part of founding the Memphis Young Professionals for the American Cancer Society about a decade back, we were able to host and feed some families as well. The Hope Lodge is such a special space for those offering free lodging to cancer patients. Memphis is so blessed to have many places and hospitals and medical institutions to be able to provide groundbreaking cancer services for those that seek it and need it. But sometimes they do not live just right in the backyard of these institutions. So to being able to provide them a safe space for them and their close family to stay and be able to have those treatments is so important. Talk a little bit about the Hope Lodge and how it's really helping those patients throughout their cancer journey.
Sure. So the Hope Lodge, it's such a resource. We have 31 Hope Lodges across the nation. Tennessee is the only state that has 2 Hope Lodges. So we have one in Memphis and one in Nashville. The one in Memphis is down on Union Avenue, as I mentioned, right next to Sun Studios. It kind of blends in with the buildings around it, so I think people miss it. But we have, I believe it's 40 rooms, and each room can house patients and their caregivers. And there's all kinds of community spaces, kitchens, everything that you need for a home away from home. And having had a child with medical issues and having had to stay in a lodging facility like that, it makes a world of difference to be able to come back and have something that's more like a home than a hotel. Here in Memphis, we have a total of about 4,800 nights this year alone that we've been able to offer. Most guests stay around 11 days at a time. We've had nearly $1 million in cost savings for our guests who do not have to pay for hotels. And you can imagine when you're going through, a cancer diagnosis, there's already so many things to worry about, and medical bills, of course, are one of those. And lodging costs, they rack up very quickly. So the Hope Lodge is a free place for them to stay, and we are able to take even kids as young as 12. So we do get some overflow from St. Jude, or sometimes we get family members where maybe not everybody could be housed over at the St. Jude facilities. And so maybe some of the caregivers stay with us. But it really is just an outstanding resource for folks who have to come into the Memphis medical community for their treatment. And I wish that more people knew about it, because it's a resource that simply doesn't get used as much as it should. So I hope that people will spread the word about that, because it's such an answered prayer for people who are having to travel for their treatment.
Absolutely. Now, how can the community support specifically the Hope Lodge? Are there still opportunities to come in and cook? Is it more post-COVID that, it's more of a providing meals at the door, or what sort of ways can the community get involved with them?
Sure. So COVID, of course, hit us pretty hard. We had to, close down a lot of things for that. But these days we are back to full operations, and groups can come in and serve dinner. And so we have 4 kitchens, and groups, can come in and they can prepare meals there. They can bring meals in. They can have meals catered. So yeah, that's one great way that a group can come in and serve a dinner. Groups also come in and, provide entertainment of any sort, a game night. If you are proficient on the violin, or you're a singer, or, what have you, you have to think about, these folks have been probably in medical or hospital appointments all day long. They're exhausted, emotionally and physically exhausted. They come back to the Hope Lodge in the evening, and when there is something that they can, a distraction of some sort of entertainment, some sort of interaction, a chance to be with other people, it's just such a gift. So we love when groups come in. We do allow minors to come in. They have to be accompanied by adults, but I think they have to be 12 and up. So we have, sometimes we have youth groups and things like that that come in. They'll serve dinner. They might play bingo. They might bring a craft. So there's, those sorts of opportunities. We also have wish lists, because we always need supplies there, of course. You can go online, I believe, on the Hope Lodge Facebook page. They probably, I think, post a lot of their needs. We also have an Amazon wish list, that sort of thing. So there's always needs in that regard. And of course, donations always help, because running that facility, it really certainly is an investment on our part. So, but we love to have people come out and visit. It's a wonderful facility. So absolutely, come on by, serve some dinner, play games, visit with our guests.
And it's so centrally located, like you said, right next door to Sun Studios. It is a
It is.
beautiful facility, and it really is a home away from home for many of those that are having cancer treatments nearby. So October is Breast Cancer Awareness Month. Each year you have Making Strides Against Breast Cancer Walk, which is a significant event, not only in our area, but I mean, it is a regional gathering of folks as well. Tell us about this event and its importance.
Sure. Okay. So as you said, October is Breast Cancer Awareness Month. And on October 19th, this is Saturday morning, we'll be at Shelby Farms Park. And this is our first year at Shelby Farms for the walk. It is our 24th year in Memphis. So we're pretty excited about that. Next year, we'll celebrate a quarter of a century in Memphis. But we'll start at 9:30 on Saturday, October 19th, with all kinds of family fun activities. It's just going to be a great morning of fellowship, fundraising, celebrating all of the fundraising that folks have done, support for our survivors. There's a wonderful tent for survivors where they come and they can be pampered, and there's a connection that they're able to make with people who are going through something similar, and the support that they feel from everybody that's gathered that day. So from about 9:30 to 10:30, there's a lot of things going on for kids and families. There'll be some live entertainment from the stage. Around 10:30, we'll start with a little program with some speakers. And then at 11 o'clock, we will start the walk around Hyde Lake there at Shelby Farms. And it really is a beautiful day to see thousands of people out there in support of our breast cancer survivors, walking for those who are still with us, walking in memory of those who we've lost. And it's just a wonderful community event. And it rained last year. I've been told it rains every other year, so we should be good for this year. I'm counting on that forecast. But yeah, we'd love it's open to everybody. There is no registration fee. We do love for people to fundraise. Oftentimes people will form teams, and so they'll fundraise in whatever way they want. You can have a bake sale, a car wash, sell t-shirts, whatever the case may be. That's entirely up to you. But we come together on that day to celebrate all of the fundraising and support that's been done over the months leading up to October. So it's a wonderful day of community, and everybody is welcome. We'd love for everybody to come out and join us this year.
Absolutely. It's such a culminating celebration of the survivors and family who have experienced those with cancer. Unfortunately, in this day and age, even my extended family, just this past month, we've had four or five cancer diagnoses
Wow.
between just the families close to me. And like I said, everyone at this day and age knows someone who currently has cancer, experienced cancer, or unfortunately lost their life because of it.
Absolutely.
So the groundbreaking research that American Cancer Society is doing is pivotal to just the work that we can do to eradicate this awful disease. Before we talk about voices and some more about the research, I do want to touch on a unique campaign that the American Cancer Society does, and one that I was blessed to be a part of, which was the Men Wear Pink campaign. Explain what it's about, how it helps fight against breast cancer, and then this year's goal.
Okay, so the Men Wear Pink campaign is also held during Breast Cancer Awareness Month in October. It's kind of the brother campaign to Making Strides. So we invite men, local leaders are either nominated or it's by invitation only. Um, we shoot for about 30 guys. This year we have 32 ambassadors. And their job is to spread awareness through their social, their professional networks. We ask them to wear pink every day in the month of October. Some of them are head to toe. Some of them it's just as simple as a lapel pin or a bracelet, but every day they have on something pink. And we ask them to raise a minimum of $2,500. Most of them raise significantly more than that. Our goal this year is $165,000, and I have no doubt that these guys are going to do it. They are very pumped, and it's a fantastic group of guys this year. We have got representation from government, nonprofit, Fortune 500 companies. We've got some TV personalities, a celebrity show. We even have a world championship poker player. So it's a really interesting group of guys this year, and we are excited about it. So yeah, so we get them together in some social aspects so they get to know each other and they make a connection. And then for the month of October, it's very competitive. They really get into it. And like I said, several of the guys are already fundraising. We have a whole lot of them that have already reached that first $2,500 goal. And they get these little contests going between them. And that's been a lot of fun to kind of watch those unfold. So it's a really neat, it's probably my favorite campaign that I deal with because it's a wonderful group of guys who are just really motivated. Some of them have been affected personally. Maybe their wife or loved one has had breast cancer. Some of them not personally, but they feel connected to it in other ways. And so it just really is a powerful thing to see these men step up for this campaign. And men can get breast cancer too. And that's something that not everybody realizes. We expect about 300,000 women to be newly diagnosed this year, but also about 3,000 men. So it's not just a women's disease. And that's some years we have male survivors. We do not have a male survivor as an ambassador this year, but that has been the case in the past. And I think that's important for people to understand that men need to be aware of this disease as well. So they can also share that information during their campaigns. But it's just a fantastic group of guys. I'm really excited about it.
It really is fun to see their unique creativity and the competition between them to be able to raise these funds that are so important for the success of the American Cancer Society and your research. So we mentioned it in the beginning. We've mentioned it a few times. Talk about the Voices cohort study, which is a groundbreaking new initiative. Explain the goals of this study and why it's so important.
Sure. So Voices is a cohort study that we launched just earlier this year. It's the first of its kind. It's a long-term study, and our goal is to enroll at least 100,000 African-American women in 20 states throughout the country. The states were chosen based on cancer rates and that sort of thing, where they were most predominant, and we felt like the research would be most vital. So we hope to better understand health conditions like cancer and improve the overall health among Black women. They have been historically underrepresented in research. And so this is a next generation type of study that we hope will kind of help us overcome some of those previous limitations that we've seen. And really help us to optimize health for Black women across the country. So like I said, it's the first of its kind. We're very excited about what we'll be able to learn and apply to future research. But we need 100,000 African-American women. And so that is a huge task to recruit that many participants. And folks can go on cancer.org and look under our research tab and find some more information about eligibility and whether or not they can enroll. It's really not a difficult study. Most of it is questionnaires. And so there isn't a lot, in terms of medical intervention and that sort of thing. It's really more about collecting information from the cohort participants. So it's an easy study to be a part of. There's nothing to be afraid of or anything like that. I know a lot of people have, white coat syndrome. It's not like that at all. But it really could make a world of difference for our future research and folks facing cancer and other diseases in the African American community in the future. So it's such an important study, and we really hope that people will want to get involved.
What other local resources does the ACS provide in Tennessee?
So one program that I'd love to share with everybody is called Road to Recovery. And this is our RIDE program. One of the biggest barriers we see to cancer care in the Memphis area and in the Mid-South is transportation. For you and I, it's difficult to wrap our brains around the concept of not being able to just hop in our car and go somewhere. But for so many folks here in the Mid-South, that is a real issue. And so we have a program called Road to Recovery where we train drivers. They go and pick up people. It takes maybe an hour of your week. It's very easy to volunteer. They go and pick up the patient, take them to their appointment, and then get them back home after their appointment. It is the difference between life or death for some people, because if you have chemo 5 days a week and you can't get there 5 days a week, your results, your outcome is going to be markedly different than if you were able to make all of your appointments, or even just screenings, any of these types of things that are such important pieces of cancer care. If you can't get there, you can't get the care that you need. So COVID really took a bite out of the Road to Recovery program, because obviously we had to shut it down. And so we have rekindled it in 2023. We're really working to rebuild the program. I think we have about 15 drivers right now. We need double that. We need twice as many as that, people to come out and get trained and volunteer to be drivers. Like I said, it can be 1 hour a week. 1 hour a month. It's really not that much of an investment of time, but it can make a world of difference in somebody's life who needs that ride, to their cancer care. So that is one thing that I would really urge people to get involved in, because that's an important resource that we offer, but we need the help of the public to get out there and volunteer to do it. Like I said, we have 1 million+ volunteers. There's only 3,000 staff members. We have to have the help of those volunteers, or we can't do this work alone. We count on that. So I'd love for people to get involved in that. Again, you can go to cancer.org and search on the Road to Recovery program, and it'll drill you down right to Memphis to get involved in that. So that's a valuable thing that we do. We also have a program called Reach to Recovery, which is more of a mentoring type program. So we pair breast cancer patients, for instance, with other folks who have been through breast cancer. It gives them someone to talk to, a mentorship type of program. And then one thing that it's a national offering, but is our 800 number. We have a 1-800 number. It's 1-800-227-2345. And it is open 24 hours a day, 7 days a week. They offer 200 languages. There is someone there at all times of the day or night to answer questions about treatment, diagnosis. If it's 2 o'clock in the morning and your mom has been diagnosed and you are just in a panic and you need to talk to somebody, there is always someone on the other end of that line. And I know many, many people who have used this resource, and it's just outstanding. The folks who answer those calls, many of them are survivors themselves, so they can really relate. So that's a fantastic resource as well that I hope people will really use, because, and you don't have to be the cancer patient. Like I was saying, if it's a loved one, a friend, whatever the case may be, if you have questions, that's a great place to start. Our website's fantastic, cancer.org. So much wonderful information there. We get about 96 million visits to the website. The call center, I want to say we had something over 350,000 calls last year alone. So it really is a vital resource for people who need it. So those are great things that we can do right there so easily. Pick up the phone, hop on the computer, get some information, get some support, maybe some relief.
Yeah, and even just knowing that you're talking to maybe a survivor, at least an expert, someone that is guided by the American Cancer Society to provide you with answers or resources to help you throughout this journey, whether, like you said, you are the one diagnosed with cancer or your loved one is. Just knowing, I can think of so many questions that I may have. And so to be able to have a resource to dial the phone or go to cancer.org and get the research that you need and the answers that you are looking for is so great and valuable to.
And we've all jumped on the internet at 2 o'clock in the morning and diagnosed ourselves with something ridiculous on WebMD. So
Yes, yeah,
I've done that personally.
Yes,
And this
yes.
is a much better resource. This is, someone is on the other end of that line or on cancer.org. You can trust that the information is valid and we follow the science. And so, it's a much better place to start than getting on WebMD and scaring yourself, with some sort of crazy diagnosis or information that may not even be correct that you find on the internet. So check those out. Go there first.
Yes, a great addition there. Now, what puts a smile on your face when you look at the work that you and your team are doing at American Cancer Society, specifically in this Mid-South region, in providing hope and resources to those recently diagnosed with cancer or those longtime survivors?
This is a tough job. I've been in fundraising for most of my career. I've been with the American Cancer Society for about a year and a half. And I tell people I have a love-hate relationship with my job because I love what I do. I love it. I can't wait to get out of bed every day. And even though what I'm doing is just a tiny part of this fight against cancer, just knowing that I'm a part of it, I love that. I just hate that I have to do this job. So I tell people I work every day to put myself out of a job. The best thing that could possibly happen to me is that we have to close our doors because this beast, I call it the great equalizer. I have an exercise I do when I speak to groups where I come in and I ask people, will you please stand if you know someone who has been affected by cancer, either personally or just, coworker, church friend, whatever. And everyone in the room stands up. And then I ask, okay, well, please stand if you don't know anyone. No one ever stands because everyone knows someone who's been affected by cancer. And so to work in that cancer space is a very powerful place to be in terms of emotional investment. It's a very rewarding job, but it is a tough job, because we lose people. My closest friend is battling breast cancer right now. So I've lost 6 family members to cancer. It's deeply personal for me. And so it is a job, but it's also very much a personal investment for me that I feel very close to. So I smile all the time when I walk into the Hope Lodge and I see those amazing faces in there and the people behind the counter at the Hope Lodge who are just so full of love and support and hope. It's just an amazing place to be. So it's definitely, it's a rewarding job, but it is a tough job. So like I said, love-hate relationship. I love what I do. I love the people I work with and work for. Just wish I didn't have to do it.
Yeah, well said. I mean, there's tears of happiness and joy, and then there are tears of grief and sadness throughout the journey. And I can imagine that it is a very rewarding but tough job as well. And so hopefully one day we have to say American Cancer Society is no more because cancer is cured. And so the importance of research and advocacy and bringing people from all back walks of life together to fight this disease is so important. Where can people, again, go to learn more, check out the links, resources, and sign up for any of the initiatives that American Cancer Society is involved in?
Absolutely. So our main website is cancer.org. My email is marissa.lima@cancer.org. And we're on all of the social media. You can find us on Instagram and LinkedIn and so on. So we're easy to find. And our Hope Lodge is down on Union Avenue. So if you'd like to come out and join us there, maybe serve a meal or play bingo with the guests or what have you, that would be great too.
Thank you for the incredible work that the American Cancer Society is doing to fight cancer and support those affected by this disease. Thank you for powering the good in our community and around the globe.
Thank you so much for having me. I appreciate it. Thanks for letting us share our mission with your audience.